Well, that's a tragic story, and Dr. Yerlink, I'm sure that's one you're all too familiar with. But what happens to a person when they overdose?
The primary concern with an overdose is that when the quantity of opioid is too high, the person's consciousness declines, but also their breathing stops. And so opioids affect many parts of the brain, but in the brainstem, the lower part of the brain rests our breathing center, our respiratory center. And what opioids do is they effectively turn that off at high doses. And so if someone's got an opiate overdose, what you'll see is that not only are they unconscious, but they are breathing less and less frequently, and eventually they're not breathing at all. And the obvious consequences of that is that tissues like the brain don't get oxygen, and they therefore die.
Now, he said that they brought him back. How would emergency doctors have done that?
That would be done with the use of a drug called naloxone, which is kind of the antidote to these opioids. It effectively kicks those other drugs off of the receptor and takes the place. It doesn't actually do anything to the receptor except occupy it. So somebody who's got an opiate overdose, within a minute or two of getting naloxone is wide awake and they are breathing normally, but they are also in withdrawal. And so more than once I've seen patients who have been on the verge of death, and we'll give them naloxone and they're now alive again. But they're in withdrawal, and they often, it's very unpleasant. It's acutely triggered withdrawal by an intervention that's meant to try and save their lives.
Boy.
Yes, there's 50,000 poisonings per year. 28,000 of them are children. All poisonings, all drug overdose is a respiratory emergency. You've got to give them air. They've taught millions of people in this province to give chest compressions only, and they're doing it. This is what public health has taught millions of people to do. All these signs here prove your heart's beating. Could be any of the hundreds of causes of breathing emergency. And then they tell you to do this. Call 911, and then naloxone and their chest compressions. All these black boxes, they're mine. Cyanotic blue background, dying lack of oxygen. Anyway, it's mass murder, and any child knows it. Because you got a breathing problem, give them air, there's nothing wrong with their heart. All these doctors making themselves sick and get their own family members killed. This is the Ministry of Health, what they were teaching. And they stopped it. They changed it up in May 2018. It would start with chest compressions on a nice blue background. Color skin dyed lack of oxygen. This is the people down at Moss Park, where they reversed all kinds of overdoses and saving anybody's life that has a breathing problem because they need air. ASAP. Any child knows that. I watch everybody make themselves sick. All these doctors, nurses, they know it right away. That's murder. Mass murder. Your morgue is full of people killed with chest compressions they were never to receive. There's the Heart and Stroke Foundation sent them a letter. I went to the Heart and Stroke Foundation years ago, back in June 2013. Heart and Stroke wrote them a letter. Chest compressions only is for a lay responder who's never been trained for a sudden witness cardiac arrest, which there's only 15,000 of in this province per year, and it happens to people over 35 years of age, heart problems. And anyway, any 10-year-old child knows, jeepers Christ, it's a breathing problem. Breathing problems, yes sir. This is Dr. Laurie Morrison, Canadian Journal of Public Health, 2013. And Dr. Aaron Orkin, yes sir. Laurie Morrison, teaching people to do that. And they're doing it. Pushing out a beat heart. Crazy town, boy, I'm telling you. The only place in the world that likes murder and everybody. This is a conference. May the 2nd, 2018. Dr. Laurie Morrison right there. She was the chair. And there's Dr. Aaron Orkin. This is Lee Chapman. She's their RN. Reverse lots of overdoses. This Aaron Orkin had the gall to say, Well, Lee, just because you gave them oxygen or rescue breathing doesn't mean you saved their lives. At the end of the conference, he says, no, it's chest compressions. There's another one at Moss Park, saved hundreds of lives. Rescue breathing, sometimes they don't have to give them naloxone because the patient wakes up with just the oxygen alone. Jeepers. Anyway, you're all making yourselves sick. I watch ya. Because any 10-year-old child knows. And it's gonna cost you billions of dollars when they sue the government. That's David Early. And then, last year, August 28th, 700 and some odd doctors and nurses and me and everybody, we went down and had a sit down with Kathleen Wynne at the legislature. Told her to stop murdering everyone. Because you're all making yourselves sick. It's called cognitive dissonance denial. As you're all being murdered. I watch all these, this is common quotes, pharmacists, EMS, MDs, and RNs while crying. I know, they're murdering everybody, I know, it's no brainer. So you should stop murdering people because it just increases drug use and abuse, makes a dysfunctional civilization. Anyway, no brainer, boy. Because you won't be able to stop. You'll be unconscious from an illness or injury, lack of oxygen. Place is crazy. Absolutely nuts, because they knew it was murder right from the get-go. The only place in the world that likes murdering everybody, and you don't say anything. It's called workplace harassment. All these nurses living in fear of these dang doctors that are, and the stupid doctors are killing their own family members. God, are they dumb sociopaths? And the NDP and the Conservative Party and the Greens all know about it. Don't say nothing. Anyway, goodbye, oh hip boy. And then you're gonna pay billions when they sue the government. Taxpayers gonna pay for billions of dollars. Goodbye. Smarten up.
Quickly, we know that when you teach people rescue breathing, that it is what we call a high fidelity or a high level of training intervention. It's something that if you learn it quickly and you learn it sloppily, you don't perform it optimally, it simply doesn't work at all. It doesn't do anything, and it might actually detract from other interventions that are extremely effective. So what I will say is this: airway management and rescue breathing may be effective under some circumstances. It's a big and important part of what I do, but it's one of the hardest things that I do as an emergency physician, and it's one of the hardest things that paramedics do in a pre-hospital setting, especially if they want to do it well. Expecting the general public to take on that skill in order to address an epidemic that is sweeping across our communities is, I think, really quite an overwhelming challenge. And we have lots of science, lots of data that shows that when we ask that of people, when we expect the public to take on interventions that are so challenging, so complex, and so difficult to do well, sometimes people freeze.
Canadian Journal Public Health, Volume 104, Issue 3, page 200. There, there's Dr. Orkin there. I talked to all these doctors down here. There's Dr. Laurie Morrison right in here. Oopsie daisy, she knows better. She wrote the 2010 guidelines that says rescue breathing only. Anyway, they taught this to tens of thousands of people, and they're doing it on a nice cyanotic blue background and color your skin dying lack of oxygen. Whoopsie daisy.
The paramedic service is actually very well prepared. They all have naloxone. The most important thing when they get on site is actually ventilation as well as naloxone. But I think what we heard loud and
Well, we were told today that, for example, because that precise example was used as to whether other first responders should have naloxone, and it was said that that was not the case, that the priority, for example, when the fire department are often the first to arrive, should be on ventilation, as Dr. Yaffe just said. But let me just say this about the budget. When it comes to saving lives in this manner, we...
Not chest compressions, as they taught tens of thousands of people are killed. That's right, killing anyone with any of the hundreds of causes of breathing emergency, and it's costing you an untold fortune. So many left with permanent brain damage, etc.